Hello, I'm Michelle Hemingway, and I'm going to be doing a piggyback administration of medication through an IV line. So the first thing I'm going to do is implement my standard protocol, double checking the physician's orders with the patient's MAR. Also double checking that I'm working with the correct patient using the patient's date of birth and the patient's name, as long as I'm using two forms of identification and identifying this patient. So the physician has ordered us to do vancomycin 500 milligrams via piggyback. So I am going to calculate the dose rates for that. The drop factor for that, it needs to be infused at 100 milliliters per hour. So I've gone ahead and calculated that here, as you can see. So he wants it done over 100 milliliters per hour times 10, which is the drop factor, over 60 minutes. So I'm going to be doing 16.66 drops per minute, which rounds out to about 17 drops per minute. All right. So the next thing I'm going to do is go ahead and wash my hands, which I've done, and then get my gloves ready. I have all my medications prepared already. And I want to go ahead and double check that I am going to be doing vancomycin and that it is not expired, which is correct. I'm going to go ahead and be inserting it into the small piggyback bag. So go ahead and clean the port that it's going to be inserted into. Get my vancomycin injected into the bag. Using the scoop method, I will recap the needle. At that point, I just want to go ahead and mix my bag, making sure that I don't create any unnecessary air bubbles within the medication bag. And at this time, I want to go ahead and put on my medication label, putting the client's name, the drug that I'm going to be administering, the dosage of the drug, and time of administration, and my initials onto the bag. Okay. Now, I am going to get my mini line tubing out. Which is here, and I want to attach the needleless device to the mini bag. When doing so, I want to make sure that I clean the port with alcohol, both ports that I'm going to be injecting it into. And then I can go ahead and get this hung on my IV pole. I'm going to go ahead and get my line primed. Okay. And then unclamping it to make sure that there is a free rate of fluid and there's no obstructions in the small tubing. At this point, I want to go ahead and just talk with my patient very briefly about the procedure that we're going to be doing again today. So we're going to be doing piggyback IV administration of vancomycin. I want to make sure that the patient has no allergies to the vancomycin. I also want to make sure that I understand the reason that the vancomycin is being ordered, which is typically ordered for patients who have an infection or a way to prevent an infection. I also want to be knowledgeable that vancomycin may cause nephrotoxicity and ototoxicity, so I need to be aware of those signs and symptoms that a patient may exhibit if there is an adverse reaction to the medication. I also want to palpate the patient's IV and make sure that there is no signs of infiltration, phlebitis, edema, any pain as I'm palpating the area, and just ask the patient in general if the IV has been okay for them. So at this point, I am going to go ahead and assume that this IV is still patent and is okay to be inserted. So I'm going to go ahead and drop my pole down here. Actually, I'm going to go ahead and just get this attached first with my needleless device. So before I do that, though, I want to make sure that I minimize the risk for infection and clean both sites. I will prime the tubing and make sure that I have it set on 17 drops per minute. as well. Now I'll calculate that watching as 17 drops per minute infuses into the tube. I also want to go ahead and drop my primary line down as my secondary line, allowing the piggyback to be infused first. So I'm going to go ahead and reestablish the flow rate, which I have done here, and then I am going to continue to observe infusion of this patient and the medication. Once this is done, I can disconnect this and reapply my alligator clamp, and then I will need to apply a new sterile needleless device, which will be my alligator clamp. At that point, I can go ahead and then reestablish the flow rate of my primary IV bag. And as well as that, I need to dispose of any needles and syringes that I've used, put those in the sharps container, and then I can go ahead and document this procedure on the patient's MAR, documenting the time, drug, dose, route that I used for administration purposes, and also document the area that I did do the IV in, making sure that I document whether it was clean, dry, and intact, or if I noticed any erythema, swelling, inflammation, those types of things. I also want to make sure that I say where I did give the IV. In this case, it would be in the patient's forearm, and then I also want to record the volume and intake and output of the patient. And that is how you do a piggyback IV.